We have Dr. Todd Vento with Intermountain Healthcare, an infectious disease expert. And Dr. Vento, we're all trying to balance safety and also these holiday gatherings just around the corner. What's your advice and recommendation?
Yeah, I mean, I think folks have heard it this past week. It's come from the Centers for Disease Control. It's come from other healthcare authorities, our Department of Health, and many experts as well. As the first priority would be, and recommendation would be to not gather. I know that sounds harsh, but the reality is we just have such high case transmission rates that the more we gather, the more we increase the likelihood of spread, not just within ourselves, but then taking it to other folks in our communities. And then we sustain this curve, and that results in hospitalizations and deaths. And so that would be our first recommendation. And really would really hope that folks would be disciplined enough to try to do that this year and connect emotionally through video conferencing and support each other that way, so that later we can actually get together in a safer time.
Yeah, the actions that we're doing now can definitely affect things in the future, and we need to be vigilant. Now, what could you tell people? We're just 2 days out with Thanksgiving. A lot of people have already planned, but if you could touch the hearts of people at home right now and avoid these gatherings of people who are outside of their homes. I know students are back from college. What would you say to them? What is your plea?
Yeah, I think this concept, and we've talked about it, is that we have a high amount of asymptomatic spread, and upwards of 50%. And in some communities in the country, we've actually seen 60–70% of people don't know they have the virus and they're spreading it. We now have these risk calculators or estimates to say if you were to gather with 5 or 10 or 15 individuals in a certain community, like in Utah, what's your likelihood of transmitting the virus? And right now, that's probably between 30–40%. If you have a gathering of up to 10 people for Thanksgiving indoors, then you have about a 35% chance of being exposed to someone who doesn't know they have the virus from that gathering. So really, it doesn't make a lot of sense to take that chance, because the other thing I would say is that it's not that folks say, oh, well, only a few people die or only a few people get sick. And the reality is our hospitals are overrun right now. They are just overrun. We are at capacity in terms of our number of staff, and very close to capacity and even over capacity for some hospitals for actual beds. And that means that the more we increase our gathering next week, in 2 weeks from then, which is the time period between Thanksgiving and Christmas, we're just going to have ourselves hospitals that are beyond overrun, and it will result in increased suffering and increased death. And I know that sounds harsh, but it's just our reality right now. It's really important that we are disciplined to not have this moment of gratification, give thanks in other ways, so that we can then celebrate later when it's much safer.
Such great advice. And Dr. Bento, if anything else, let's do it for our healthcare workers who are at the burnout stage tenfold. So we thank you for what you're doing, and let's stay safe this Thanksgiving. Thank you so much. For more information, always, you can go to intermountainhealthcare.org. Thanks again, Dr. Bento.